Hey guys, Dr. Joe with you today, talking about everybody's favorite topic, root canals and dental abscesses. Okay, so maybe that's probably not everybody's favorite topic, but it is something that you need to know about and know what to look for so that if you do happen to get one, you know what to do. That's all in today's video. Okay, so tell me if this sounds familiar. You have a tooth, it's starting to hurt, it's getting worse over time, it hurts whenever you bite down. Pain medication really isn't helping all that much. It's almost always happens whenever you can't get into some place, like on a weekend, Friday, Saturday. And if it's ever happened to you, believe me, you will never forget it in a million years. If you haven't ever had one of these, then consider yourself lucky and make sure you keep up on your dental care, because believe me, it is no picnic. So let's kind of break down today, what is a dental abscess, when do we get abscesses, and why do we get abscesses? And there's three main reasons. Number one, decay has spread to the inside of the tooth and it's infected the nerve. This is by far the most common way, and inside teeth are millions of little tubules that allow fluid to move back and forth. And if decay gets near the nerve, or there's a really deep filling, then bacteria can pass through those tubules and get into the nerve. Then what happens is the nerve gets infected. If it's left untreated even longer, then the bacteria can actually come out of the bottom of the tooth root and it can create an abscess there, and that's why you get the swelling, the pain, the heat. And if you let that be down there even longer, they can actually dissolve the jawbone around the tooth and cause the tooth to get loose. Not super fun. So what that actually looks like on an x-ray is you have a tooth and you have a big kind of a black ball around the end. Now, the second way that a tooth can get abscessed is if the abscess spreads from another tooth. So you have multiple teeth here, and these are my teeth, and anyway, an abscess on one can actually spread to other areas. And if it happens, then we have to treat all the teeth that have the abscess, whereas if we catch things really soon, we can just treat the one tooth. And that's kind of the more conservative approach, so that's why it's nice to catch things while they're little. The third way that you could potentially get an abscess is if you get bumped in the tooth or hit on those front teeth. That can develop an abscess over time, and it can also lead to the tooth getting darker, and that's something that's nice to avoid too if we can. All right, so those are the three main ways that an abscess can develop. But now what? What's the best way to treat them? And by far the easiest way is to catch them early. Catch them early. Go to a dentist that's very proactive about catching abscesses while they're small. The best way to do that is go to a dentist that can take a three-dimensional radiograph. And what that is it's instead of looking at the normal two-dimensional radiographs, like the little bite wings and things like that, the 3 dimensions allows us to see which teeth have the abscesses and also where they are in the mouth. On one of the 3-dimensional radiographs, we can look at all the abscesses in the mouth and we can kind of develop a plan. Another nice thing about a 3-dimensional radiograph is that if there's a tooth with multiple roots, we can take and we can see which individual root the abscess is on. And so that's really nice. We'd have to treat the whole tooth, but we can tell between multiple teeth and really figure out which tooth is the offender. So now that we've found the abscess, we know exactly which tooth it's on, where we start. What do we do next? Well, we start you on antibiotics generally. If we know that the area is painful and swollen, we generally get about a week's worth of antibiotics, and that's going to calm everything down. After that, that gives us about a window. We can go in there and we've got a couple of different options. Thank goodness we are at a time in dentistry and history because we have got better pain-free options than literally ever before. For example, in the past, if you wanted to have a tooth taken care of, you did one of two things. You either pulled it or you would do a root canal. And those were really the main two options. By the way, a root canal is whenever you can get the area super numb, we clean out the nerve of the tooth, and then we fill that in so that the bacteria can't keep coming out of those root tips and reinfecting the bone that it's in. In the past, and really still a lot today, a lot of dentists in an effort to try to save every tooth that they can, will do a root canal, sometimes on a tooth that's maybe a little bit too far gone. Now, the downside of this approach is that if we're trying to save a tooth that's too far gone by doing a root canal or something like that, and then we put a crown on top of it, which covers the tooth, kind of like a cap, and it keeps it from breaking down even further, then a lot of times, over time, that fails. Then we have to do an implant or something else after it. And I don't really like that approach because, well, then you wind up doing 2 times the work. We do the root canal, we do the buildup, we do the crown, then we have to take it out and do an implant. My philosophy is if the tooth is getting abscessed and large and it's not going to last you more than 5-6 years, get that thing out of there. Let's take it out. Let's replace that by an implant, and don't waste your time, don't waste your money. Another big difference is that you also have something that's going to last the rest of your life and not something that's just going to last a few years and maybe you have to redo it. So now one more thing to consider is that if an abscess has been there for a long time, a lot of times it can actually dissolve the bone around where that tooth is. And if we do that and we take the tooth out, a lot of times instead of just being able to place an implant right back in there, we have to build that area back up with bone graft, which is sterile bone particles. Looks like pure white sand. We put that in the socket, we stitch it up, and that holds the graft in place. Now, I get asked all the time, where does the bone graft come from? And kind of a fun fact is that when it's the bone sawdust that's created whenever in orthopedics they are cutting discs. So, fun fact. All right, so now this brings us to another area where our approach is definitely different than other places, and that is in the treatment planning phase and what is all done under one roof. All of our post-operative care, surgery, it's all done here, and this is hugely important because this allows us to control every step of the process and make sure that we have a super predictable outcome. If we did things more traditional, so to speak, like most places do, we refer out for the tooth being taken out, and then we have the tooth taken out, the bone graft would be placed elsewhere, then we'd have the implant placed elsewhere, we'd have you come back in, we'd do the crown on top. And the real kind of a reason that that's an issue is because there's a disconnect between all those steps. So instead of me being able to control every single step from the very beginning, we have to take and hope that the guy down the road is going to do a really good job. And it's hard to control everybody else's quality, whereas we can take and make sure that every single step is designed from the beginning so that you know exactly what you're going to get at the very end. And that is super, super, super important. Kind of a side note is that anytime somebody is coming from out of town, and a lot of people really are that come here, St. Louis and further, so what we try to do is we try to bundle appointments as much as possible when they want to. And the big reason that's hugely important is because we don't want people to have to make a whole bunch of different trips if they want to just come down and get a lot done. So we really want to try to be extremely, extremely flexible because everybody's needs are super different. And so the first step we do is we get you in and we sit down with you, we define a plan, we tackle the goals that you have, large or small, so that we can get your best smile ever. So sitting down with us is definitely the first step. We get you in, get you a free consultation, and that's what we do. So if you found this video useful, hit the subscribe button and bell, and we'll keep the videos rolling. Thanks for watching, and see you next time.